So for the lower extremity pullovers, we have a couple different options, but before somebody lays down, even before they get to the table, make sure they have a pillow that's been wiped off, and sometimes it's just a matter of turning it over to use the other side. If you ever get a pillow that has a little crack here, because these do that sometimes, it's kind of irritating, and just have it on that side, okay? But always cleaned off, because these get shiny when they're not, so you know it's obvious that somebody else had laid down there, and that's just something that our patients deserve better. Go ahead and lay down on your back now, there, Luke. There's a couple different ways to do these overhead pulleys, or these lower extremity pulleys, and we have to be careful if somebody has a sciatic nerve that's irritated, or even a greater trochanter that's irritated. I'm reluctant, especially with greater trochanteric bursitis, just that friction is I think too much until their IT band is released. So be careful with that, and again, be careful with the sciatic patients. It can be a great exercise for them, but there's a certain sequence. So we're going to assume maybe even that Luke is vulnerable in his sciatic nerve, and we're going to take those precautions. For right now, I think I'll have you bend this knee. There you go. And that is just to take a little bit of stress off the back. We're going to put this belt around here. Strap it just like that. Nice and snug. Okay. And then I've already set that at 15 pounds. I'm going to walk out. Keep it close to your body. It'll be easier. And then just hook it in. We are just almost too far away. We just barely reached there. Otherwise, we'd have to scoot everything up. So Luke, you're going to gently raise this like that. Keep your knees straight. Okay, stop. And so we're going to go back down. So try to control this a little bit more. I want you to stop about right there for right now. And then as you're pushing down, I want your abs in and tight. And I want you purposely contracting your glute as you press this thing down, okay? And start real small with the motion. So just start right there. There we go. And again, getting back to that whole sciatic nerve thing, I feel okay right now because Luke's ankle is in a plantar flexed position. I'd feel even better if his knee was a little bit bent here, okay? And we know that the nerve is not being traction. I would probably feel even better if his opposite leg was straight in this case, so go ahead and drop that one. And that will just take the nervous system out of a little bit of slack. So this would be something in the early stages. As a person starts having less nerve irritation, we can progress them to actually bending the other knee. There we go. And then doing it like that. And then as they feel even better, we're going to add a little bit of an ankle stretch here. So go ahead and flex your ankle up and do that. That's going to be, and keep your knees straight this time. So there we're getting more nerve tension. And sometimes you want to build into some nerve elongation, but other times you definitely want to avoid it. So we never want to aggravate a nerve. If we really wanted to do some nerve mobilization, I would have you hold your head, Luke, as if you were, now let's go ahead and go down like this. So you're going to lift your head up a little bit as if you were doing a sit-up or an incorrect crunch. And then when you come up like that, that's even mobilizing the nervous system more. And again, a person would have to be very high level and not have any reproduction of nerve symptoms when they're doing this. So that's with it around the ankle. Some people are not going to tolerate that, and we can actually get a better stretch through here if they have lace-up shoes. So let's go right into the lace-up shoe mode. You can stay right where you are. Luke, I will have you scoot up just about 2 inches on that table though. So I'm going to take this off, and we're going to hook this into his shoelaces. Again, works very well when you have people that have some sensitivity here. Most people like this method better. You just want to make sure you grab shoelaces that are down quite low. You want to make sure that they're tied up here well. Sometimes I'll even double tie just to make sure, but we should be good there. And then I'm going to clip on to this. And Luke, it's the same exercise You may feel a little bit more of a stretch out of it though. See how that flexes your ankle up like that? And then you're gonna go up. So on the shoelace, you know, if a person was having sciatic symptoms, I don't think I would do it just because it does dorsiflex the ankle, and that could be a bad deal. How does it feel to you comparing the two? Do you like one better than the other?
I like this one better.
Yeah, I like that one better too. And see, you could still, you don't have to go into dorsiflexion. His foot is still partially plantar flexed. Again, if, especially if he had any sciatic nerve stuff going on, I would insist that his head was relaxed when he does this. Just like that, chin tucked like that, always working on posture, abs in, glute squeeze. How about the feeling of having this knee bent versus having it straight? Do you have a preference on that?
Straight's better.
You do like that straight, yeah. So in straight, you do get you get a couple of added benefits here. When it's straight and Luke goes all the way up, let it go all the way up. He gets an opposite stretch on this left side, so you get a little bit of a Thomas stretch. I don't know, do you feel that at all in your left hip when you do that?
No.
Just ticklish. There you go. Try to keep this foot straight up and down. And Luke has a tendency to hyperextend his knee just a little bit. There you go. So we would actually have a person not bend it that much, but just try to be just shy of hyperextension. And that's actually something good if you're working on a lower extremity and you're trying to stabilize the knee out of hyperextension. You can actually have them do something like this because they have to use their hamstring to keep that from locking out. It's a form of rhythmic stabilization that can be effective, and so has multiple uses.